Exalta Health started originally as an alternative to Planned Parenthood, but over time and through prayer, it's really expanded into a multi-service medical organization. We picked Burton Heights because there was no other healthcare in the area that was meaningful. The neighborhood was kind of lacking in healthcare and actually in a lot of things. And putting a medical office in the middle of that seemed like maybe not the smartest idea, but it turned out to be a huge blessing. And also at this time, we also started realizing that there were more needs than just OB needs, that primary care was lacking. And so we expanded our vision for what we wanted to do from just a Planned Parenthood alternative to a very faith-based, non-denominational, but very Christian focused health organization.
I started volunteering way back in college for anything I could volunteer for, and as I became a physician, it was something I knew I wanted to do. Many of the patients that I saw were ones that were new or that Laura didn't have time to see at the time. It was an ongoing clinic, and so my role was as a fill-in and assisting the staff here. Early on, the camaraderie that I felt was just something I couldn't leave and just wanted to continue through the years. I really enjoyed early on in the clinic the idea that the clinic saw the patients that were in the gap between the ones that had Medicaid and the ones that had private insurance. So you were really seeing the hardworking poor at that time. Then came the dentistry came in, and dentistry was really nice, and I got to do physicals just to get people in to see the dentist. They didn't want to see me, they wanted to see the dentist, and it was very important. So that was a big plus in Exalta.
The services and all the things we've done have just expanded through the years, and bringing dental in and just full services. It's been quite remarkable to see. We used to see, a few patients in a week, and now we're seeing hundreds and thousands in a year, and it's really got a huge impact in the neighborhood.
And another good thing about working at Exalta was that it gave an example to my children. And they would see me and my wife working down here as volunteers, but they could come by also and help us out in the clinic, volunteering at various different jobs here, short time periods where they would, get a clue about what their parents are doing and see what we value.
Another thing we started very early on is having prayer prior to the morning and prior to the afternoon times of volunteering. I think that helps reorient the staff and puts the focus right on the right thing. And we used to just do a verse, but as more Hispanic people started coming and volunteering and patients, we do both a verse in English and Spanish, which is really quite neat. My dream and hope for Exalta Health is that they would never lose the reason this was started.
My hopes for the future for Exalta is one that it continues to function because it is so needed in the community and that it does such a great job, and the people give such holistic care to the community. The community comes here and they know, from the receptionist to the nurse's aide to the volunteer to the nurse to the provider, that they are being cared for here. Not only with just trying to figure out what's wrong or what medicine they need, but spiritually what they need also. It's just amazing what the clinic does for the community. So I really wanted to see it to continue and hopefully expand.